Describe the hardest decision you've had to make recently.
The hardest decision I've had to make recently occurred during a particularly busy evening shift on the medical ward. I was caring for an elderly patient, Mr. Davies, who was recovering from a fall that resulted in a mild concussion and significant bruising. While his vital signs were stable and his headache had improved, he was still exhibiting some subtle gait unsteadiness, especially when fatigued, and occasionally forgot why he was in hospital for a moment. The medical team had planned for him to stay one more night for observation, particularly given his age and a history of previous falls. However, around 8 p.m., Mr. Davies became insistent that he wanted to go home immediately, stating he missed his cat and felt perfectly fine. He was legally competent and articulate in his request, although clearly weary. My immediate task was to assess his capacity to make an informed decision and then to manage this delicate situation, balancing his right to autonomy with my professional duty to ensure his safety. The hardest part was deciding how much to push against his wishes versus accepting his decision and mitigating the risks. I initiated a thorough discussion with Mr. Davies, calmly explaining the risks associated with his mild unsteadiness and potential for another fall, especially without immediate access to medical support. I used clear, simple language and encouraged him to repeat back his understanding of the risks. I then quickly consulted with the charge nurse and the on-call doctor, providing them with a comprehensive update on his latest assessment and his adamant desire to leave. We collectively agreed that given his assessed capacity, we could not legally prevent his departure. My action then shifted from attempting to persuade him to stay to ensuring the safest possible discharge against medical advice. I meticulously documented the entire conversation, including his stated understanding of the risks. Crucially, I contacted his daughter, explained the situation, and coordinated immediate follow-up by a community nurse and arranged for a mobility assessment to be done first thing the next morning. The result was that Mr. Davies was discharged. While it was a decision that initially felt unsettling because it conflicted with my ideal clinical judgment for his full recovery, my decisive actions ensured he left fully informed with crucial support systems in place. This experience deeply reinforced for me the profound ethical complexities we navigate daily, where the hardest decisions often involve balancing patient autonomy with our unwavering commitment to their safety and well-being.
Describe what you think great patient care means.
Great patient care, to me, means a truly holistic and human-centered approach that extends far beyond merely treating a medical condition. It's about recognizing and responding to the patient as a complete individual, encompassing their physical, emotional, social, and even spiritual needs, rather than just focusing on a diagnosis. At its core, it embodies profound empathy and respect. This means actively listening to understand their fears, concerns, and unique circumstances, validating their feelings, and preserving their dignity at all times. It's about treating every person with the utmost kindness and valuing their individual perspective, even when it differs from the clinical path. Effective communication is absolutely fundamental. This involves clearly explaining complex medical information in an understandable way, ensuring the patient and their family are fully informed about their condition, treatment options, and potential outcomes. It's a two-way dialogue, encouraging questions and fostering an environment where shared decision-making is truly possible, empowering them to be active participants in their own care journey. Beyond compassion and communication, great patient care demands clinical excellence and unwavering commitment to safety. It means applying the latest evidence-based practices, adhering to rigorous safety protocols to prevent errors, and constantly striving for the highest quality outcomes. This commitment extends to continuously learning and adapting, ensuring care is always at the forefront of medical advancement. Ultimately, it's about making the patient feel seen, heard, safe, and valued throughout their entire experience, from the moment they seek help until their recovery or ongoing management. It's the seamless coordination between healthcare professionals, the quiet reassurance given during moments of vulnerability, and the dedication to alleviate suffering while promoting their overall well-being. It's personalized, proactive, and deeply compassionate care that leaves a lasting positive impact on their health and spirit.
Describe a mistake that you made on the job or in clinicals and how you handled it.
In my early days in clinicals, during a particularly demanding medical surgical rotation, I made a mistake related to medication administration, which became a significant learning experience for me. The situation involved a patient who was on a complex medication regimen, including a new oral anticoagulant. It was a very busy morning, and I was trying to manage multiple tasks simultaneously, including assisting with patient transfers and preparing for rounds. My task was to administer the patient's morning medications, ensuring all rights were adhered to. In my haste, while scanning the medications, I inadvertently pulled the wrong dose of the anticoagulant for the patient. It was slightly higher than the prescribed dose for that morning. I was about to administer it when a small voice in my head, a nagging feeling, prompted me to pause and double-check one last time before giving it to the patient. Upon that final conscious review, I immediately realized my error. The dose I had in my hand did not match the medication administration record precisely. My immediate action was to set aside the incorrect dose, retrieve the correct one, and then re-verify all 5 rights of medication administration from scratch before administering it. After ensuring the patient received the correct medication safely, I promptly informed my clinical instructor about the near-miss error. Together, we completed an incident report detailing exactly what happened, the steps I took to correct it, and the importance of that final critical check. This experience, though no harm came to the patient, was incredibly impactful. It served as a powerful reminder that vigilance and strict adherence to protocols, even under pressure or when feeling rushed, are non-negotiable in nursing. It taught me the invaluable lesson of pausing before acting, especially with high-risk tasks like medication administration, and the critical importance of self-correction and transparent reporting. Since then, I've adopted a personal rule to take a deliberate deep breath and mentally recheck my steps before any critical intervention, ensuring I never compromise patient safety for efficiency.
Describe a time when a coworker or nurse manager made you upset.
I recall a situation from a few years ago where I felt quite upset with a colleague over a patient care issue. We were working on a particularly busy surgical ward, and staffing was a bit stretched that day. My colleague John was struggling to manage his patient load, and in an effort to save time, he started cutting corners on some of the routine documentation for his patients, specifically the hourly input-output charting for a post-operative patient. My task was to ensure accurate and complete patient records, as this documentation is critical for fluid balance assessment and detecting potential complications. When I noticed the omitted charting, I felt a surge of frustration because it compromised patient safety and created extra work for anyone reviewing the chart later. Initially, I felt upset, thinking he was being negligent or lazy. Instead of confronting him in front of others or letting my emotions guide me, I took a moment to calm down. Later, during a quieter period, I approached John privately. I started by expressing my concern about the patient's well-being and the importance of accurate fluid balance. I said, "John, I noticed the INO charting for Mrs. Smith seems a bit sparse over the last few hours, and I'm concerned we might miss a critical fluid shift if it's not consistent. Is everything all right? Or can I help with anything?" He immediately seemed defensive, explaining he was overwhelmed. I listened to his challenges without interrupting. Once he finished, I calmly reiterated the patient's safety risks associated with incomplete charting and offered to help him catch up with his tasks once I finished my own, or brainstorm ways to manage his workload more effectively if this was a recurring issue. I also suggested we could raise our staffing concerns with the charge nurse together later. By focusing on the patient and offering support rather than criticism, the situation de-escalated. John acknowledged the importance of the documentation, apologized for the oversight, and we worked together to update the charts. This experience taught me the value of approaching difficult conversations with empathy and understanding a colleague's potential struggles, rather than jumping to conclusions. It reinforced that effective teamwork and direct, respectful communication are crucial for resolving conflicts and ultimately, for ensuring the best patient outcomes.
Why do you want to work for our company?
My interest in your esteemed institution stems from a combination of its outstanding reputation for patient care and its clear commitment to professional development, which deeply aligns with my own nursing philosophy. I've conducted thorough research into your organization, particularly noting your dedication to holistic family-centered care, and this deeply resonates with my professional values. What truly sets this organization apart for me is its documented emphasis on interdisciplinary collaboration and nurse empowerment. I firmly believe that exceptional patient outcomes are a direct result of a supportive and collaborative environment where every team member feels valued and encouraged to contribute their best. My experience has shown me that fostering a culture of continuous learning and mutual respect is paramount, and your organization's ethos appears to champion exactly that. I am particularly drawn to your recent accreditation for patient satisfaction, as it speaks volumes about the quality of care delivered here. Furthermore, I am keen to grow my skills and contribute to an environment that challenges me to excel. I see immense opportunities here to further develop my expertise in acute care nursing and patient education while working alongside a highly dedicated and experienced team. I am confident that my skills in critical thinking and compassionate communication will be a valuable asset to your unit, allowing me to not only provide outstanding patient care, but also actively contribute to your organization's mission of delivering compassionate, evidence-based care. Ultimately, I want to be part of a team that consistently strives for excellence in patient care, and from everything I've learned, this institution embodies that commitment.
What's the most important quality a nurse can have?
While many qualities are absolutely essential for a nurse to possess, such as compassion, communication, empathy, and resilience, if I had to choose the single most important quality, it would be critical thinking. Critical thinking is the bedrock upon which all other aspects of excellent nursing care are built. A nurse must constantly assess dynamic situations, synthesize complex information from various sources, patient symptoms, medical history, lab results, team input, and then rapidly analyze that data to make sound clinical judgments. It's about being able to identify subtle changes in a patient's condition, anticipate potential complications, prioritize competing demands in a high-pressure environment, and make swift, accurate decisions that directly impact patient safety and outcomes. Without strong critical thinking, even the most compassionate nurse might struggle to provide effective or safe care when faced with an unexpected crisis or a complex diagnostic puzzle. It allows nurses to apply evidence-based practice, adapt care plans when initial approaches aren't working, and advocate effectively for their patients by understanding the why behind interventions. It's the cognitive engine that drives problem-solving, proactive intervention, and continuous improvement in practice. While compassion provides the heart of nursing, critical thinking provides the intelligent, analytical mind necessary to translate that compassion into tangible, safe, and effective care.
How would you handle a rude physician or supervisor?
When facing a rude physician or supervisor, handling the situation professionally and effectively is crucial. It's important to protect yourself while also contributing to a positive work environment and ensuring patient care isn't compromised. First, take a moment to assess the situation calmly. Is this a one-off instance due to stress, or is it a recurring pattern? Consider if the rudeness is directed at you personally, or if it's a general demeanor they exhibit towards others. This initial assessment helps you decide on the most appropriate course of action. If you feel comfortable, and the rudeness isn't overly aggressive, a direct, yet polite approach can sometimes be effective. This should be done privately, not in front of patients or other staff. You might say something like, "Dr. Sam, I felt that comment was a bit sharp, and it made me feel disrespected and uncomfortable. I'm committed to effective teamwork, and I'd appreciate it if we could maintain a respectful tone." This shows you're addressing the behavior, not attacking the person, and you're focusing on the impact of their words. Regardless of whether you choose a direct approach, documenting the incident is vital. Note the date, time, specific words or actions, who was present, and how it made you feel. This isn't about retaliation, but about having an objective record should the behavior persist or escalate. Continue to observe if this is a pattern of behavior and how it affects others. If the rudeness continues, impacts patient care, creates a hostile work environment, or if you don't feel safe or comfortable addressing it directly, then escalation is necessary. This typically involves speaking to your immediate supervisor, a charge nurse, or human resources. When you do so, present your documented observations calmly and factually, focusing on the behavior's impact on morale, teamwork, and ultimately patient safety and care quality. Frame it as seeking a solution to improve the work environment, rather than lodging a complaint out of anger. Throughout the process, prioritize your own well-being. Don't internalize the rudeness. Remember, it's about their behavior, not necessarily your performance. If direct interactions are unavoidable, maintain your professionalism, focus on factual communication, and keep boundaries clear. Seek support from trusted colleagues or a mentor if needed. By handling such situations systematically and professionally, you contribute to a healthier work environment and reinforce the standards of respect and collaboration that are essential in healthcare.
Why are you a good candidate for this job?
I believe I'm an excellent candidate for this nursing position because my skills and professional philosophy perfectly align with the demands of this role and your institution's commitment to patient-centered care. Throughout my career, I've cultivated a strong foundation in critical thinking, allowing me to quickly assess complex patient situations, prioritize effectively under pressure, and make sound clinical judgments that prioritize safety and optimal outcomes. For instance, in my previous role, I often managed a diverse patient load, requiring rapid decision-making to address emergent situations while still maintaining high standards of routine care. Beyond my technical competencies, I'm deeply committed to compassionate and holistic patient care. I believe that genuine empathy and clear, respectful communication are just as vital as clinical skills. I excel at building rapport with patients and their families, ensuring they feel heard, understood, and empowered in their healthcare journey. I also pride myself on my adaptability and dedication to continuous learning. The healthcare landscape is constantly evolving, and I am proactive in staying updated with the latest evidence-based practices and embracing new technologies or protocols to enhance patient care quality. I've also researched your organization extensively and am particularly drawn to your reputation for staff development and ongoing professional education. My collaborative approach to teamwork and my passion for continuous improvement would allow me to not only integrate seamlessly into your team, but also contribute meaningfully to your mission of providing exceptional care. I am confident I can make a significant and positive impact here from day one.